My capstone project involved developing a proposal to offer teen health centers in high schools. I will be discussing the reasons as to why I think it is important that high schools make adolescent health a priority. Teenagers face enormous struggles during a vulnerable time in their young lives. 17% of students aged 12 to 19 in the United States seriously considered attempting suicide in the previous 12 months. Suicide is now the number 2 cause of death among this age group. The same group has also seen a rise in obesity, mental health issues, sexually transmitted diseases, reported bullying and violence incidents, and drug use. As they learn to function in an increasingly complicated world, they must be able to count on access to reliable resources that enables them to make healthy, informed decisions in relationship to their physical and mental health. Unfortunately, these resources are not always available to adolescents. Therefore, I wanted to explore what is currently being offered at the high school level and discover what is actually needed. After careful examination of surveys, interviews, current programs, and literature review, the need for teen health centers was established. A comprehensive, easily accessible, confident source for mental and physical health information must be made a priority for all high school sites across the state. The Center for Disease Control states that the health of young people is strongly linked to their academic success, and academic success and achievement are strong predictors of future overall health. Since there is a correlation between health and student success, it is clear that more needs to be done to provide physical and mental health services. The Washington State Education Board has a vision of an education system that prepares all students for a college career and life. In 2018, graduates from Washington State schools must graduate with 20 credits, but only 2 of those credits are required in health and fitness classes. High schools cannot prepare students for healthy lifestyles if the essential teaching of good health is overlooked. Individual school districts can also determine how students meet those health requirements. They can be met either as a standalone health class or a combined health and fitness class. Many students have the option to ask their district to waive their health and fitness classes because of their involvement in outside physical activities. Others take a health class merely to fill the requirement without regard to the content or implications for personal health. Whatever the reason, many students are not receiving the vital information required to make informed health decisions. This project examines existing local and out-of-state programs currently in place and proposes additional strategies to effectively address the establishment of an information source to strengthen health and increase the likelihood of teens entering adulthood as healthy, successful citizens. These services can be accomplished by creating on-site resources and providing personnel that can speak personally to students who need information on a variety of health issues. The inspiration for my project was sparked by the groundbreaking health program that has been implemented into the high schools in the San Francisco School District. The San Francisco Wellness Initiative is a program that is dedicated to improving the health, well-being, and academic success to the 16,000 high school students in the district among the 19 campuses. The Wellness Initiative works in partnership with the San Francisco Department of Public Health and the San Francisco Unified School District. There is an on-site center on every campus dedicated to helping teens gain skills to cope with physical and mental health issues. Each on-site center is staffed with experts in adolescent health, such as a wellness coordinator, a nurse, a behavioral therapist, and a community outreach worker. The centers specialize in providing medical services, case management, behavioral health counseling, and addressing other critical health concerns. The centers were established 18 years ago and have slowly transformed to what they are today. 93% of the students report their health and well-being has improved since they entered high school. 94% of students have reduced their use of tobacco, alcohol, and drugs, and 87% of students believe there is an adult in the wellness center that cares for them. To explore possible solutions to the problem of teen health crisis, I utilized different methodologies to gather important information. After learning about the San Francisco Wellness Initiative, I wanted to use the program as a measuring stick of what can be achieved when healthcare resources and public schools work together. Therefore, I looked at 2 other school districts and compared their existing programs. What I found is that there are different standards of healthcare options available depending on where a student lives. For example, Seattle Public Schools are introducing school-based health centers into public elementary, middle, and high schools in the district on a smaller scale. These school-based health centers are operated by community health agencies and offer services such as physicals, preventative care, treatment of common health problems, and immunizations. There is usually a nurse and a social worker on hand during the school day. The Families and Education Levy of Seattle will invest $235 million between the years of 2012 and 2019 to the Seattle School District. $44 million will be invested in healthcare specifics and $21 million will be invested into high schools. While it is a start, it is not nearly enough money distributed given the fact that there are over 54,000 students in the Seattle Public School District. And the school-based health care system reaches only about 6,000 of those students annually. In comparison, although a much smaller district, Bellingham Public Schools employ only 7 full-time nurses who have the responsibility of covering 21 different schools in the district, which often means there isn't always a healthcare provider available on campus when someone needs one. The counseling staff provided at the high schools in Bellingham is limited as well, as there are only 3 counselors employed at each high school, which averages out to 1 counselor for every 400 to 500 students. The counseling services offered focus more on career planning and development rather than personal health concerns. Next, I created a survey of mental and physical health issues, and students were randomly selected on 2 separate campuses, one in Seattle and one in Bellingham. There were 35 statements that the students noted their responses by writing short answer or by indicating a score on a rating scale of 0 to 4, with 0 indicating strongly disagree and 4 indicating strongly agree. Sample items included statements like, if I have a question regarding a personal mental health issue, I can talk to someone at my school who can support me, or the most critical health problem facing teens is blank, or I know how to protect myself from sexually transmitted diseases. The responses from this survey aligned with what was to be expected. In the district where access to healthcare in high school is non-existent or minimal, in Bellingham, 52% of surveyed teenagers receive their health information from peers and only 8% from school sites, according to the sample interviews and survey results. Because the information they receive from each other is not necessarily reliable or current, they may be at risk for ill-informed or incorrect information, leading to unhealthy choices. In contrast, 58% of students living in a district where there are established health centers and schools, such as Seattle, reported they receive their information on-site. The information they receive is more accurate and detailed and supports a teen's healthy development. Students residing in a district that does not have health wellness programs are more likely to report higher incidence of unsafe behavior and health concerns than students who attend with health wellness centers. Bellingham High School students surveyed reported higher incidences of risky behavior, concern over peers' health, worry because of an unresolved health issue, and unhealthy habits than their Seattle counterparts. In addition, surveyed teens in communities lacking health centers reported their dissatisfaction at 64% with the information and care available at their schools. Finally, students who do not have access to information report a lesser degree in confidence in their knowledge of physical and mental health issues at 42%, compared to students who are confident of their healthcare knowledge at 68% when information is readily available. These results also support the information gained through interviews. One 9th grader at a public high school in Seattle said, I can talk to someone about personal problems at school, and I feel like I can get the information I need when I need it. I don't go often, but it feels good that there's someone available. This outlook is supported by other students interviewed in the larger district where health centers are more viable. But in the smaller district, in Bellingham, it is a different story. A 12th grader at Bellingham High School said, we have a place where we can go get some general info, but it's nowhere near what students need. I have friends who are depressed and worried about things, and even though we have counselors, they are too busy doing class stuff and college searches than helping with mental problems. Students interviewed in Bellingham tended to be more vague about what mental and physical health services were available to them as compared to students in Seattle who could describe on-site services at their schools. This information supports the fact that not all students have adequate access to healthcare at a time when they need it the most. Steve Morris, a Bellingham director for teaching and learning of family engagement, said nurses have about 2 days a week at each high school. It would be nice to have more support. He believes pressure needs to be continued in districts where health centers are non-existent or barely meeting minimum requirements for care. The data serves as a push for intervention at the teen level. Due to the complicated legal and monetary issues necessary to navigate the process of introducing a new school program or curriculum and the length of time such a process would entail, it was not feasible to put an actual healthcare center into place at a high school level. However, to develop effective healthcare services, the factors I discussed should be considered when creating a teen health center in addition to the following. The guiding belief behind the creation of a teen health center must be physical and mental health care is crucial to the development of healthy young adults. Washington State must adopt a policy of ensuring students are adequately prepared to enter adulthood with healthy habits by providing resources they can access on a daily basis. After adoption of such policy, the Washington State legislature must be held accountable by both parents and school districts to fully fund health centers. The legislature establishes the concepts and skills necessary for safe and healthy living. They have the power to influence the Office of Superintendent of Public Instruction to shape the development of teen centers. The Office of Superintendent of Public Instruction is required by state law to develop learning standards. These learning standards should include knowledge and skills learned in healthcare centers, including the acquisition of healthy physical and mental habits. Teen health centers must operate during full school hours. Teens must have access to trained and experienced physical and mental health professionals when they need it. Written information from outside resources should be available on a range of topics, including sexual behavior, gender identity, drug and alcohol practice, tobacco use, nutrition, and weight issue, bullying and intentional and non-intentional violence, including cyberbullying, depression, anxiety, and chronic health conditions. Professionals in the teen health centers should be able to steer teens to further resources and follow up when necessary. Confidentiality and trust are priorities between the professionals and teens. Funding for teen health centers must be shared across multiple agencies, including school districts and community health programs. State and national agencies must also provide funding, since healthy young people only strengthens the community and lessens the need to further down the road for physical or mental interventions. Incorporating these factors into the development of teen centers across the state will ensure that centers serve to improve teen health habits, decrease teen crisis, and allow teens accessibility to health information.